Good morning, everyone, and I'm Gwen. I'll be sharing to you my topic regarding CBT, stands for Cognitive Behavioral Therapy. And this is another approach or psychological treatment that has been demonstrated as effective tool in attending various problems of depression, anxiety, eating disorders, marital problems, and mental illness, etc. Later on, I'll be showing to you a video clip about the actual demonstration of the therapist using CBT as his therapeutical approach. Also, another video of how depression was dealt through CBT. Okay, and this morning we will learn the definition of CBT, brief history, the pioneer person of CBT, and how CBT works or can be used in particular situation. CBT in depression, CBT in anxiety, and the pros and cons of CBT. Now, let's start and let me show to you my slides. Okay, so here, uh, cognitive behavioral therapy. Now, what is CBT? CBT is a type of psychotherapy or a talking therapy. And in here, the psychologist and the patient or the client work together in a collaborative fashion to develop an understanding of the problem and to develop a treatment strategy. So CBT therapists emphasize what is going on in the person's current life rather than what has led up to their difficulties. So there will be a conversation between the therapist and the client. So a certain amount of information about one's history is needed, but the focus is primarily on moving forward in time to develop more effective ways of coping with life. And also, there is a type of psychotherapy or a talking therapy wherein it is used to communicate with with the patients. Now, the purpose of talk therapy is to help people identify issues that cause emotional distress. And for some people, these issues are complex and may result in a diagnosis such as depression or anxiety. So later on, I'll be explaining to you how CBT works in a depression and what types of anxiety uh, does CBT covers. But for others, talk therapy may simply serve as a place or as a safe place to discuss feelings and emotions triggered by daily stressors, a medical illness, relationship issues, grief, and loss, or the impact of specific trauma. So here, cognitive behavioral therapy, cognitive, it means or it refers to thoughts, and behavioral refers to actions. So how one thinks, it is in cognition, and how one acts in behavior can affect how one feels. It is in mood. So negative conditions will arise, and maladaptive behaviors can cause one to feel low in mood. So CBT is applied to the people who have these negative conditions or a problem with their behaviors. Therefore, by identifying and correcting negative conditions, cognitions, and maladaptive behaviors, mood can be improved. So here is the brief history of CBT. Aaron T. Beck is generally considered the pioneer of CBT in the 1960s, while he was a psychiatrist at the University of Pennsylvania. Having studied and practiced psychoanalysis, Dr. Beck designed and carried out several experiments to test psychoanalytic concepts of depression. He developed cognitive therapy for treating depression. And it was subsequently expanded to include behavioral components and became CBT. Since then, CBT has been successfully used for a range of disorders, either on its own or in combination with medication. So here is Aaron Beck, born in 1921. So the rationale for CBT, I have here is a summary, for CBT, how this treatment done. So it offers more of a treatment approach than a pharmaceutical approach, just as effective or better than using medication. Or sometimes it is done with medication. Offers a clear model and plan for clients, and it causes significant change in behaviors, and material is reinforced and linked to sessions. Now, the use of CBT in clinical practice. CBT is a time-limited therapy. So usually it takes 12 to 16 sessions, and sessions take place once a week by 50 or 60 minutes, and other research or other um, work or session takes or lasts about 60 minutes. The goals of treatment are clearly identified at the beginning of the therapy. So the therapist here, surely ilang i-identify what's the main problem or what's the goal of the treatment. So there will be a list of awareness or list of problems, para masayon pag-identify unsa or pag-cater ang problem. Now, the progress is regularly monitored during therapy. Okay? And the patient is an active participant in the therapy. So there are times also that the patient is reluctant, but it is more effective if the patient is active in this therapy. The patient is usually given tasks or homework to complete between sessions. This not only the therapist or the psychologist will only talk or do the advising or counseling, because sometimes it takes pudisad na ay mahatag na advices, or how do you call that? Also, the patient will usually given tasks or will do their homework. Rating scales are usually used at the beginning of therapy and at the end of therapy to assess effectiveness of therapy. Now, in CBT, the focus is on the here and now. So the history of the patient is considered, but the focus of CBT is here and now, the present situation, the present condition, the negative present cognition and behavior of the person or the client. The focus of CBT is not the origin of the problem, and the main objective of CBT is to help the patient use practical cognitive and behavioral strategies to overcome the problem. By using practical or any strategies through CBT, so wishing and hoping that this patient will overcome the problem. So I have here a differentiation between experiential therapy and cognitive behavioral therapy. So the goal here of experiential therapy is to dive deep into one's past experiences, and the CBT uncovers the thoughts behind one's decisions. And the format, experiential therapy, is to help a person learn by doing actions such as the following: role play, animals, music, and the art. And the CBT, a therapist will ask questions to challenge a person's thought processes that an event, shape an event. And the ideal clients of CBT is it is best for committed people who are willing to work with a therapist on issues that are hard to discuss openly. And for CBT, it is suitable for people of different backgrounds and experiences, and even those that are reluctant to participate. So there are people who are, or clients who are reluctant to participate, and also as CBT is also works for them. But it is more ideal if the person or the clients will participate. Clients is an active participant. So the proven efficacy of CBT is, or experiential therapy is yes, and CBT is yes. So studies have found big benefits in terms of psychological distress and psychological well-being. And CBT has a considerable amount of research that proves its efficacy, and there are so many researches that proves how effective CBT is. And also, um, let's differentiate the CBT and the exploration or exploratory psychotherapy. In CBT, this is a short-term therapy, and exploratory psychotherapy is a long-term. And CBT is for mainly for depressions and anxiety disorders, and I will be discussing that later on. And this exploratory is for mainly for personality disorders. And the main focus is on the of CBT is on the here and now problem that are obvious currently. And the main focus of exploratory is how early life relationship experiences have contributed to current problems. So this exploratory will talk about the past experiences, childhood maybe, and how that experiences contributed to current problems. And in CBT, therapist is active, advising patients and giving a task or work or homework tasks, um, processing how that the person um, felt and what the reason for her or his depression. And also in exploratory psychotherapy, therapist is passive, with the patient doing most of the talking. So in CBT, the therapist will do the more, or will challenge the patient, and will do the talking most of the time. But also this is a two-way communication by a true uh, patients nga mo respond in every questions. And here in exploratory psychotherapy, the patient will do the most of the talking. And CBT, negative cognitions or conditions and behaviors are identified. So in what you see in the video clip no na ay kuan dito, at a therapist that would ask the clients na how did the client feel, or unsay problem presently, and what are the negative cognitions or the negative thoughts nga mao yung reason nga nakapahadlok o nakapag-depress niya. And in exploratory, unconscious process are hypothesized. CBT in depression. Let me show to you a short video clip about how CBT is performed in depression.
The following scenario looks at using a brief CBT approach for a depressed mother with a young child. Depression is characterised by negative thinking styles, low mood, fatigue, and a reduction in activity levels. Notice how the GP uses the structured 5 areas of the cognitive behavioural model to identify the individual patient's specific negative thoughts about herself as a mother, as well as her key unhelpful behavioural changes. Later, she offers an empowering explanation for the patient's tiredness symptoms, which she calls depression tiredness. This helps to provide a rationale for increasing her activity levels.
I know when we met a few weeks ago you were quite keen to look at some ways to try and manage your depression, maybe without medication. Is that what brings you in today?
Yes, I'd like that.
Right, okay. I'd like to take some notes if that's okay, just to keep track of what we talk about. Would that be okay with you?
Yes, that'll be fine.
You can have a copy to take away afterwards. What I find quite helpful is if we talk about a specific situation. I wonder if you could just think of a time, maybe a recent time, when you felt particularly depressed and it affected you.
Well, a few weeks ago I was due to meet up with some friends from antenatal classes. We used to meet up every week, but I felt so tired and low, I just couldn't go.
Right. So what was going through your mind when you were feeling tired and low that stopped you wanting to go?
Well, I started thinking about the other mothers laughing and chatting, and I wouldn't have anything to say.
And what would that mean if you didn't have anything to say?
They'd probably think that I was boring. Why would they want me there if I was just going to make everyone else miserable?
They sound like some really difficult thoughts to have. And how did it make you feel when you were thinking that?
Really low.
Right, okay. It's really understandable, I think, that you'd feel low if you're having quite self-critical, very negative thoughts, and that's quite common in depression to have those type of thoughts. Did it make you think anything about how they might see you, for example?
Well, the other children always seem so happy. I started thinking maybe the other mother's doing a better job than me.
Right.
I worry a lot about Molly and wondered if she'd be better off with one of the other mums.
Right, okay. That must be really painful. And how does it make you feel to think that Molly might be better off with one of the other mums?
It made me feel really sad.
What tells you that Molly might be better off with one of the other mums?
Well, they always seem so in control with my depression. I just feel guilty that I'm not a very good mother.
You've mentioned a number of emotional feelings. You said you feel fed up, low, sad, and sometimes guilty. Do you have any physical symptoms or body reactions?
I get quite tearful, although that's mainly when I'm on my own. I'm so tired, I just don't have the energy.
Right. Are you getting good sleep at the moment?
Well, Molly keeps me up sometimes at night, so that makes me tired. But even after a good night's sleep, I'm still exhausted.
Right.
And now, let's talk about CBT in depression. Its aim is to overcome negative cognitions and the unhelpful behaviors that maintain the depression. So the negative cognitions, for example, the person or the client would say, I will never get better, I am worthless, it's all my fault, it's all in the mind. No, mao ni ang yang gihunahuna, negative thoughts and unhelpful behaviors, and what are being manifested in behavior nga manifest sa iyaha is social withdrawal, avoiding activities, staying in bed for a long period of time. So mo ni kasagaran na feel sa mga person who are in depressed, no, and the aim of CBT is to um, overcome unsay negative cognitions and unhelpful behaviors, and these unhelpful behaviors are the reason why the depression is maintained. And the key terms used in CBT in depressions: dysfunctional assumptions, negative automatic thoughts, and cognitive distortions. So what is dysfunctional assumptions? Dysfunctional assumptions are extreme and inflexible opinions that people form about themselves and about the world. Examples: person or the client will say, if I'm not perfect, I cannot be happy. So he will assume kinsa siya, thinking he's not perfect, and he will conclude, will be happy anymore. And if I don't succeed in everything I do, I am a failure. So in here, this person considered himself as a failure. And dysfunctional assumptions remain latent or dormant until there is a critical stressful event when they then lead to negative automatic thoughts. And what is negative automatic thoughts? So here, the description of negative automatic thoughts and its contents of this the content of these thoughts tends to be related to the dysfunctional assumption that precedes them. So negative, it means have negative themes. So what's in the mind of this person is all negative. And automatic, it means they keep popping in one's mind. So whenever he will encounter some events, negativity will keep on coming or popping in his or her mind. Examples of this is I will never be happy, I will always be a failure, and this negative automatic thoughts then makes the depression worse. So CBT is a help, no, of this kind of problem. Now, cognitive distortions. Kung sa man ang cognitive distortions. These are errors in thinking that are commonly seen in depression. So these errors serve to maintain depression. CBT aims to identify such errors and helps the patient to correct them. And this process is called cognitive restructuring. If there is um, distortions of thinking or thoughts, ang CBT aims niya to identify, to classify such errors and helps the patients to correct them. And mo ni gitawag og cognitive restructuring. Usbon, no? Um unsay negative thoughts. Examples, all or nothing, jumping to conclusions, magnification or minimization, overgeneralization, okay, disqualifying the positive. This thinking is an absolute. The person could think that um, his negative thinking or thoughts niya is absolute. Words such as always or never, everything, nothing, etc. So characterize this thinking. A person applies for a promotion at work. For example, he does not get promoted while a colleague does. He concludes, I will never be get or I will never get promoted or I am always a failure. So mo ni iyang hunahuna. And also, the other example is jumping to conclusions. And um, um, this person would keep on thinking negative conclusions with insufficient evidence. So there are two types. For example, in mind reading, no, colleague does not smile back, and that person concludes he has no longer or he no longer likes me. And fortune telling, the person fails his driving test and for the first time, and he concludes that he will never pass the driving test. So this person always jumps to conclusions. And here in magnification, the person tends to magnify his mistakes while minimizing any positive achievements. So the person fails to meet a deadline at work, for example, by just one day, he feels very guilty about this. And also, on the other hand, minimization, for example, the person succeeds in meeting a deadline at work several days in advance, and he dismisses its feeling he was just lucky and deserves no credit. So uh, everything is negative. And also here in overgeneralization, so it person will make sweeping generalizations from an isolated example. For example, the patient prepares dinner for friends, and apart from one item, all the others come out very well. However, the person generalizes from the one poor item and concludes, I am a terrible cook. So uh, this person would generalize, would sweep thinking, and he will conclude that he is not good at it. Now, the key behavioral concepts. First, CBT for depression uses behavioral interventions, and CBT protocols for anxiety disorders contain elements of exposure and response prevention, facing up to a fear in a planned, step-by-step way. So there are methods of behavioral methods used in CBT. First is activity and pleasant event scheduling, graded task assignments, exposure and response prevention, relaxation training, breathing training, and coping cards. So, mo ni kasagaran ginagamit sa therapies in helping the patients through CBT and also rehearsal. CBT used for anxiety disorders. Now, CBT has been shown to be effective in a range of anxiety disorders, including panic disorder, phobias, OCD or obsessive compulsive disorder, or GAD, generalized anxiety disorder. Panic disorder. This is characterized by episodic paroxysmal anxiety. So the anxiety attacks come out of the blue. And in panic disorder, there are both cognitive symptoms and fear of fainting, fear of dying, etc., as well as physical symptoms, palpitations, sweating, and trembling. Panic symptoms can also occur in phobic disorders in response to exposure to the feared stimulus. So also in phobia, it is an anxiety disorder in which symptoms occur when the person is exposed to the feared stimulus. And so depending on the stimulus, there are different types of phobias. First, simple specific phobia, agoraphobia, and social phobia. So simple specific phobia. So the anxiety symptoms do not occur in the absence of the fear stimulus. Example, fear of spiders or arachnophobia, fear of heights or fear of enclosed spaces or claustrophobia. In agoraphobia, also in this condition, the patient has a fear of crowded places, feel fear to travel alone and leaving home. In severe cases, the patient becomes totally housebound. So social phobia, this is also called social anxiety disorder. In this condition, the anxiety symptoms manifest in social situations, public speaking, eating in public, and attending social events. So in anxiety disorders such as panic and phobias, the behavioral response of the patients to overcome the anxiety is usually one of the following two. First, the avoidance, and the second, escape. How to avoid this and to how to escape such situation. And through CBT, and hoping this activity will work for him, and this is um, proven already. No? And there are many researches proves that CBT is effective. CBT's aim is to change such maladaptive behaviors and helps the patients deal with the anxiety. So also CBT is done, no, in applied to a person who has obsessive compulsive disorder. So OCD is a disorder characterized by obsessions and compulsions. Obsession um, means repetitive, intrusive, unpleasant thought that keep coming up in the mind despite the patient attempts to resist the thoughts. Example, fear of contamination, fear for one's safety need, a safety or need for symmetry. Compulsions are repetitive behavior that are done in order to reduce the anxiety associated with obsessions. Example, repeated hand washing, repeated checking and arranging. So also in GAD or generalized anxiety disorder, an anxiety disorder in which the patient feels tense or and edge most of the time. So the anxiety in GAD is referred to as free floating. So in contrast to the out of the blue anxiety seen in panic disorder. So associated symptoms of this GAD include muscle tension, being fidgety, restlessness, insomnia, headache, fatigue, difficulty concentrating. CBT techniques used in anxiety disorder. Mm, First technique is relaxation exercise, exposure and response prevention, distraction techniques, identifying anxiety-inducing thoughts, and finding alternatives. So also, CBT is applied individually. So the term used is coping cat. No? Like many other therapy types, CBT has been successful in treating children on an individual basis. Kendall and colleagues were the first to develop and empirically test the effectiveness of a manual-based program. Coping Cat for Children and Adolescents, Kendall 1990, 1994, and Albano and Kendall 2002. Coping Cat was designed to focus on treating separation anxiety, GAD, and social anxiety disorder. And also, CBT is applied in a group like group therapy in schools. So group CBT has been found to be an effective alternative to individual CBT. So GCBT is a way for therapists to work with children with similar diagnosis and circumstances in small groups. So either way, individual CBT and GCBT have both been shown to be effective treatments for anxiety. And here are the advantages and disadvantages of CBT. First, CBT can be as effective as medication in treating some mental health disorders and may be helpful in cases where medication alone has not worked, and also can be completed in a relatively short period of time compared to other talking therapies. Another advantages focuses on retraining your thoughts and altering your behaviors in order to make changes to how you feel. The highly structured nature of CBT means it can be provided in different formats, including in groups, self-help books, and computer programs. Skills you learn in CBT are useful, practical, and helpful strategies that can be incorporated into everyday life to help you cope better with future stresses and difficulties even after the treatment has finished. And these advantages of CBT. To benefit from CBT, you need to commit yourself to the process. A therapist can help and advise you but cannot make your problems go away without your cooperation. Another disadvantages, attending regular CBT sessions and carrying out any extra work between sessions can take up a lot of your time. And due to structured nature of CBT, it may not be suitable for people with more complex mental health needs or learning difficulties such as schizophrenia. So as CBT can involve confronting your emotions and anxieties, you may experience initial periods where you are more anxious or emotionally uncomfortable. Some critics argue that because CBT only addresses current problems and focuses on specific issues, it does not address the possible underlying causes of mental health conditions, such as an unhappy childhood. So CBT focuses on the individual's capacity to change themselves, their thoughts, feelings, and behaviors, and does not address wider problems in systems or families that often have a significant impact on an individual's health and well-being. So, in conclusion, CBT is an effective treatment that has revolutionized the management of depression and anxiety disorders. The patient is an active participant in therapy and is not just a passive recipient of treatment. And lastly, in psychiatric practice, CBT techniques are usually used in combination with medication in order to try to improve outcome. So this is an effective treatment. Active participant is needed, and there are many techniques that psychiatrists or the therapist would use. No? Maybe combining medication to improve the present problem of the client. So here are my references. Thank you and God bless. That would be all. And this time, let's watch a role play of CBT, how it is performed. Let me share to you my video.
Okay, Marsha, so how can I help you today?
Well, I'm working full-time. I'm a part-time student.
Right.
I've just gotten engaged and I live at home. There's just so much stress in my life. I have everything happening all at once. Just to top it all off, I failed an exam, a really big exam, and I just feel like I can't do anything anymore. I can't do anything right. I've just got so much stress and I feel like such a disappointment, such a failure, and I've embarrassed my family by failing. I just don't know what to do anymore, and I guess I've come here today to tell you, I want to leave uni, and I guess that's why I've come here to you today.
Okay, so it sounds like a whole lot of stuff's on top of you at the moment?
Yeah, just so much, just
stressing
all piling on, yeah.
So you're working full-time, plus
part-time study.
Part-time study, and then you've got your a wedding preparation.
Yeah, just got engaged, and wedding's just a month away now. So I've just got so much happening. Work is really demanding, and just fail this exam. It's just don't know what to do. All too much. Yeah.
So I imagine you've been sweating on this for a while, and it's all been swirling around in your head?
Just been building up and building up, and so much pressure with everything. And I'm living at home, so my parents, a lot of pressure, need to do everything right. And by failing this, I feel like I've just embarrassed them and disappointed them, and I just don't feel like I'm good enough, to go on studying.
Okay. And have they said much to you about failing your exam?
They haven't said much. I was really scared to tell them, actually, because I knew they'd just be so disappointed and just embarrassed by the fact that I did fail.
Okay.
Yeah, I've never failed anything before, and so it's really hard.
Yeah. So it's new, and you don't like it at all?
Not at all, no. And I think leaving uni will just be the way out, just so I don't have to go through it again.
Right, okay. Well, I'm glad you've come to counselling, because it's good for us to get an outsider's opinion when we've got so much on our plate and we're confused as to what to do, and our emotions can get in the way. And you've just said earlier that a whole lot of stuff's on your plate at the moment.
A lot of things,
So I'm glad you've come here. Here at the clinic we use the ABC model, which is a cognitive behavioural therapy model.
Okay.
So Marsha, some counsellors have put together a list of beliefs that we often use, and we don't realise that we're using those beliefs, and they tend to be faulty ones.
Okay.
Here's the list here. Have a look through that to see if there are any beliefs that you might be operating on at the moment.
I think number 2.
Okay. Read that one out for me.
That it's necessary to have a high degree of order and certainty in order to be happy and perform well.
Yeah, you mentioned that earlier, didn't you? Yeah.
Number 4, that it's necessary to be competent and successful in all those things which are attempted.
Yeah, that's an expectation from your family, isn't it?
Yeah. Possibly number 8, that life should be entirely pleasant and enjoyable, and that any frustration, discomfort or pain would be unbearable.
Yeah. Which one of those stands out the most for you at the moment, Marsha?
Probably number 4.
Okay.
Yeah.
How would you put that in your own words?
That I need to be successful all the time in everything that I do. Yeah. And
is that different from what's happening in your life at the moment?
Well, failing that exam, I mean, I wasn't successful with that, so I mean, it just throws out, I guess even number 2, because throws out all the order in my life. I need to have everything, so I need to know what I'm doing, where I'm going, so.
Okay, so if number 4 is an expectation that your family have and that you have of yourself, how do you measure up next to number 4?
I don't feel like I'm good enough.
Okay,
Yeah.
all right. Well, what I'd like to do is put some of those ideas on the board under the ABC, and I'll explain as we go along.
Okay.
Okay. So what do you think the trigger point might be, or the activating event for you at the moment?
I mean, there are a lot of things, but I think obviously failing the exam was the main one.
Okay.
Yeah.
All right. And the consequence is you thinking of leaving
uni.
Okay.
Yeah.
All right.
Yeah.
And that statement that you made earlier about I'm not good enough.
Yeah.
That's the B one. That's the crucial one, and I'll explain it shortly when I get up to the board.
Okay.
All right. Okay. I think I'll put it up there now for you so we can work through that. So, Marsha, the activating event, which is what you stated earlier.
I failed my exam.
That's right. And the kind of decision that you're thinking about is?
Leaving uni.
That's right, yeah. Okay. So it's important that we consider the jump from here over to here, and the kind of thinking that you've been swirling around in your head affects the consequence. And you've mentioned earlier that number 4 seems to fit, and you put that in your own words. What were your words before?
That I'm not good enough.
Yeah, good. That's really important for us to consider that kind of thinking. Okay, Marsha, it's good that we've got those things on the board. And what I'd like to do now is focus stepping out a bit from your situation and looking at it from another point of view.
Okay.
To me, it sounds like you're doing a whole lot of things really well. Can you list all of the things that you're doing really well?
I'm working. It's a really demanding job, and I'm, keeping up with it.
Great,
so I guess work. Things with my fiance. I mean, we're engaged, so planning the wedding. That's going really well.
Yeah,
it's stressful, but it's going well.
And all of your other university subjects?
Yeah, I've never failed anything before. This is the first one, so I guess all the other subjects,
Yeah. And you're succeeding in all of those things put together.
Yeah.
You're juggling it, and it's a lot on your plate at the moment, but it sounds like you've been able to cope up until this point of the one exam.
This one just threw me off balance. Failing,
So, would you describe yourself as successful most of the time?
Yeah, most of the time.
Yeah.
Yeah.
And what's the evidence for that?
Passing all my exams all the time.
Yeah.
I'm just passing my subjects, not just
that's
exams.
right.
Getting that full-time job, it's a great job that I'm doing. Getting married.
Yeah, that's right. Yeah. So, how do all of those successes compare to that belief that that I've written on the board for you?
I guess in comparison, I am good enough.
Yeah, that's right. Yeah. And all the evidence is there. All of the subjects that you've passed in first year and now second year.
Yeah.
Your full-time job, that's a success.
Yeah.
It's great. Yeah, good. Okay. Well, what I'd like to do is get you to write that on the board.
All right.
To dispute that belief.
Okay. Yep.
Would you do that?
All right.
Well done, Marsha. That's a powerful statement. What kind of decision goes along with that?
Staying at uni.
Good. Okay. Write that on the board for us. Great. That's good. Good. Okay. So you've made a bit of a decision there, haven't you?
Yeah.
Okay. Tell me about it. Does it feel okay?
Yeah. I feel like I should stay.
Okay. Why is that?
I can try again. I mean,
Right.
everything doesn't have to be 100% all the time.
Good, good. Yeah.
So, I mean, I could resit the exam.
Okay. Yeah, yeah. And we've talked about all your successes.
Yeah.
So it's harder now to believe that top statement that I'm not good enough.
Yeah. I mean, I am good enough compared to all the things that you helped me realise with all the successes that I've had.
That's right.
I am good enough.
Yeah, good. Okay. And so this idea about staying at uni. Tell me about
I'll
that.
Stay. I mean, I am good enough, so I'm sure I can give it another go and see how I go from there. I can resit the exam, and I'm sure I'll be fine.
Okay, good. Okay. What I'd like you to do is to keep saying that statement, I am good enough. Say it in front of the mirror 2 or 3 times a day so that you build up your confidence, because it's going to take some time to reprogram your computer up here with that kind of positive belief about yourself, rather than carrying around that other belief. And we tend to carry those other beliefs for years and years and years, and so it's going to take a bit of work on your part to deliberately change your thinking and change your belief system.
Okay.
But you've made a great start here today, so congratulations. Well done.
Thank you.
All right.